Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we're honored to talk about Mercy Community Healthcare. We're joined by Cindy Siler, their CEO, and Dr. Don Gibson, Chief Medical Officer. How are you two doing?
Great. Thanks for having us.
Great. Thanks for having us.
Absolutely. So let's start with the mission and a little bit of history. Cindy, go ahead and dive in and give us some of the history and the mission for Mercy Community Healthcare.
Okay. Well, our mission statement is that Mercy exists to reflect the love and compassion of Jesus Christ by providing excellent health care to all and support to their families. We began in 1999, and that has been the mission from the very beginning. For 22 years, we've served the underserved and underinsured in this community. The whole concept actually started as Mercy Children's Clinic by several folks from Christ Community Church, businessmen, and other clergy in the community. And they started downtown, began providing services to folks that had no transportation and could not get access to care for children. And we've moved to the mall here, Williamson Square Mall, in 2009. And then in 2013, we became a federally qualified health center. And I'm sure you're going to ask me some things about that later, Jeremy. But as part of the history, we then became a health center that began to serve adults, because the children that were being brought in by grandparents and aunts and uncles while parents worked were not taking care of themselves and receiving the care that they deserve. So we began to serve adults and then became a federally qualified health center to help with that.
We'll definitely talk about that. And as you're alluding to, it's youth, so children, it's adults, it's families, it's primary health care, it's also behavioral health care. And so give us, when you look at the full scope, go ahead and paint the picture of the different services and offerings overall.
Yeah, okay, so thanks for having us, Jeremy. At Mercy, we offer 5 main service lines. We do pediatric primary care, adult primary care, psychiatry, counseling, and school-based therapy. We have 2 locations, one here in Franklin, Tennessee, and the other one in Lewisburg, Tennessee. We basically offer cradle-to-grave care for primary care needs as well as mental health needs.
And when you look at the group that you serve, give us an illustration, because these families are dealing with a lot. And when you look at everything that's going on with the economy, inflation and jobs and everything, home prices rising, give us a little bit of illustration, paint the picture of the families and the children and the adults that you're taking care of. So what are they going through? Give us a little bit of their life.
An FQHC, a federally qualified health center, is a community health center that has to prove that there is an eligible population within our service area. We serve not only Williamson County, but Murray, Marshall, and Hickman counties. And those families are low income. The need is great in this community. In 2018, we did a market assessment, and there were 28,000 families that were not receiving care that they were eligible to receive. And that number has only grown with the economy that we have. But I love for Dr. Gibson to share what he usually says on our tours, because he is the one that sees those patients.
Yeah, so I mean, a common misnomer is that a federally qualified healthcare center only serves indigent patients, and where the reality is that Mercy, the majority of almost 100% of our patients have a job. They're the working class people that work with us every day, waiter, waitresses, people who cut the grass, clean houses, maintenance, housekeeping, any small business. Just they don't have health benefits through their company, and small business is the backbone of the economy, and a lot of small business owners just can't afford those type of benefits. So our patients are hardworking, great people that are just members of our county, and it's an honor to get to serve them. We believe our goal is to make every request for care a yes. So our job is to say yes for patients who need health care. And we do that through a couple of ways. We take private insurance, just like a normal person who has commercial insurance, and charge copays. And then we accept all 10 cares. And then we also have a sliding fee scale program for patients who don't have insurance. Mercy's not a free clinic. but it's affordable. And part of our mission is to provide affordable primary care. So based on your income, we come up with a sliding fee that can be as cheap as $25 to as expensive as $85. And for that, you get to see a board certified physician, much cheaper than an urgent care or an emergency department. And we provide continuity of care. So we're really proud of what we have to offer. We think it's a very high quality, and we want to make it available.
When you look at the impact of the pandemic and individuals maybe delaying some of the things that they normally would do, obviously having to switch and do some things virtual with telemedicine, how has the pandemic impacted your efforts both during and obviously coming out? What have you seen for you as an organization, but ultimately the impact on the patients?
So yeah, you're right. There was a lot of delay in care during the pandemic. The pandemic focused largely on how are we going to treat COVID, and then how are we going to vaccinate for COVID. But what happened is during the shutdown, particularly during 2020 and 2021, is that there was just a delay in care. And so what that meant was a lot of people missed their primary care, which means they didn't get their screening mammograms, they didn't get their screening colonoscopies, their diabetes and high blood pressure went untreated. So now we're kind of in that catch-up phase where we're trying to catch up for cancer screenings and get people out of the hole with their diabetes and hypertension. So it really put us behind the 8 ball, the almost resistance to get medical care during the pandemic because, and rightly so, there was concern for getting infected. During the pandemic, Mercy stayed open. We never closed down a day. We knew it was a priority to keep our doors open to provide access to care. We were one of the first centers in Williamson County to be able to provide COVID vaccination. And we ran the gamut of treatments in terms of referral for monoclonal antibodies. And now we even give referrals for the oral antivirals. So we're still living in pandemic phases, but thank goodness patients are coming back.
Mm-hmm. Mary, I'd like to add to that just in gratitude to several churches in the community. In the beginning, when the pandemic happened, as Dr. Gibson said, we are not allowed to close, and we had to make some decisions about having full staff and what were we going to do. And as a community health center, we were not able at that moment to provide telehealth services. And we were actually, as a leadership team, praying about what's next steps, how are we supposed to do this? And a lot of folks in the community were bringing us lunch, trying to care for healthcare providers. We were really, really grateful for that. But we had a couple of churches that called and said, we know there's a lot of things that are being done for you, but what do you need? And at that moment, license for telehealth for us to be able to provide that when that waiver became reality was going to be over $13,000. It might have well been $13 million for Mercy in that moment. And I told the church that, and that was on a Thursday. On Friday, we received a check to be able to afford that. So wow. This community steps up, and we're grateful. We are so grateful.
Yeah, I'm glad you shared that. That's awesome. Tie that in, some of the things I think that make you unique, the faith-based aspect, but also the behavioral health. Tie that piece in, because I think that plays a very important, when you talk about mental health and well-being, to everything that's going on pandemic related as well.
Let me just do the introduction to that, and then Dr. Gibson does it much better than me anyway. But one of our driving force components of our strategic plan is body, mind, and spirit. What we want to do is care for every patient, every family that comes through the door in that manner if they need it. So integrated care has been a part of Mercy long before it became a thing in the medical field. But, and it was only because that's part of that mission to reflect the love of Christ, is to be able to serve somebody where they need it. But what has happened with our medical staff is they're really putting boots to that and making that truly happen.
Right. Like Cindy just referred to, we talk a lot at Mercy about integrated healthcare. And if you didn't work at Mercy, or you think integrated means you see all races, or that's not how we use the term integrated. We know that your health, everyone's health, is dependent upon 3 factors: your physical, mental, and spiritual health. And you can be great at heart, lungs, and kidneys, but if you miss mental health, then you miss the boat. And we believe that if you miss spiritual health, then you miss the boat as well. So when we talk about integrated healthcare, we talk about this. So yes, we do primary care, but we also address mental health needs with our psychiatry team, our counseling team, and our school-based therapist team. From a spiritual perspective, we think that is equally important, and we address spiritual needs for our patients in several different ways. One, we offer to pray for our patients and offer spiritual guidance if they want us to. It's not mandatory, of course. But the other thing that we do is we have a wonderful team here of angels on the earth called our patient and family support team. And what our patient and family support team is, they address social determinants of health. So I can be a great physician and prescribe wonderful medications, but if the patient can't afford them, then they're useless. So we have a group of our patient and family support help patients find medications, access to specialists, durable medical equipment. They even can help some with some gas and housing, but it's not really what they do primarily. But what they do is they address those social determinants that allow the patient to actually execute their health plan with us.
Our patient and family support department they're the best networkers in this county. And they have a relationship with not only other physicians and specialists, but every not-for-profit service, housing, food, clothing in this community. And so we're grateful for our sister agencies that work with us every day to provide that for our patients.
Yeah, just to echo that, we have a lot of great physicians and medical groups here in Tennessee that are Friends of Mercy. We call them Friends of Mercy. And they're like, yeah, Don, I'll be glad to take care of 3 of your cardiac patients or 3 of your GI patients. And yes, we have this equipment we can donate. So we have a ton of friends in the community and are really grateful to have such great partners.
You have a chance to see your impact firsthand, especially working directly, obviously, with the patients. Give me, the first story that kind of pops into your head in terms of why you do what you do and the impact you can have on the families in the community.
Oh man, so yeah, that's why I wish everyone could just like be on my shoulder some days, because it's hard to share. But we have a patient that, for example, she had a bad relationship with food. She was overweight. She had poorly controlled diabetes and hypertension. And we just talked, and she didn't have a lot of resources. So one of the advantages we have is that we can see her as much as she'll come. So we had regularly scheduled visits, and over a period of 4 to 6 to 8 months, she lost 40 pounds. Her diabetes became much better controlled. She had her medicines. She had access to her medicines. And at her last visit, I was having a chance to speak with her, and I said, "Look how great you've done. You've lost this weight. Your diabetes is better controlled. We're going to stop your blood pressure medications today." And she just bust out crying. And I said, "You should be really proud of yourself." And the patient said, "No one's ever told me I should be proud of myself." And the staff just went nuts. Like they just were clapping for her and cheering for her when she walked out of the room. And I've been in a position my entire adult life, and having this experience to take care of these patients it's been a wonderful thing and a blessing for me to be part of. And our provider team feels the same way. So it'll get you in the feels if you hang out here. It's great work. It's righteous is what we talk about. We do righteous work here.
Absolutely. And I think that's a great example too of how that carries over into the rest of her life, the self-confidence and how that's going to create more smiles and opportunities and friendships and relationships. Like that piece can truly transform her whole life, not just, as you mentioned, the health, but the mental, the spiritual, like all those sides can create life transformation. So I absolutely love it. Definitely indeed righteous work. So how can the community help? I know you have events coming up, you have opportunities for the community to plug in, but how can we help your efforts?
Well, for almost 20 years or over 20 years, we've had the Franklin Classic as one of our fundraisers. It is Labor Day. Come out. We have tried our best to create a family atmosphere. It's a 10K, 5K, and 1K for the kids. There's all kinds of things for people to do. It's early on Labor Day. You get done by 11 o'clock at the latest, and you still got the rest of your day to go to the lake for the last time. So that's one. We have a fall dinner that is November 11th. Thank you. The proceeds to that particular function go to our mental health patients that can't afford services, obviously. And again, Dr. Gibson can address this better than I, but counseling services are more frequent and they're expensive. And so we try to help everybody be able to afford the care that they need as a family or an individual. So we always have some of our staff to speak. We always have a speaker at that particular dinner. It is at St. Philip Catholic Church. And it's a great evening. We enjoy being with each other, and the food is always wonderful. And then we have a golf tournament in the spring every year. And so those are the three major fundraisers. I do want to mention that one of the things that we have been working on since 2018 is the possibility of having this integrated care be provided under one roof. We've learned that it's not nearly as efficient and as effective as we want it to be when we're all spread about this mall. And so we are working on, we have worked since 2018. We've purchased the property and we are moving ahead with construction. But that project needs the support of this community in a lot of different ways, and primarily prayer. but other than that, we do need resources. We're in the silent phase of a capital campaign.
Well, when you talk about getting to know you all better, financially supporting, getting involved in the events, where do we go to learn more? So mention your website, social media, phone number. Where all do we go to learn more and get involved?
All of that, obviously, www.mercytn, as in Tennessee.org. We are not a statewide or national organization. As Dr. Gibson said, we have the 2 locations. So that website is the place. Social media, we're on Facebook and Instagram, and can contact either one of us. Our email addresses are on the website, and it's easy to find. What we would do, Dr. Gibson and I, is encourage anyone that is interested, that wants to know more. We right now have a tour program, and we're bringing folks in. Takes about 50 minutes, 50 minutes of your time. Anytime during the day, we will schedule it. And we love bringing people in and showing them what we do and giving them a vision of where we want to go.
100% of the donations to Mercy stay right here in Mercy, right here in our community, taking care of people in our community. And so we're real proud of that it's money well invested.
Absolutely. The website again, mercytn.org. And Cindy, Dr. Gibson, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you, Jeremy.
Thank you so much for having us.